So it was really a introduction to surgical management as well as other sort of device-aided or device-guided therapies for our Parkinson's and essential tremor patients. So we focused on deep brain stimulation, which is one of our main sort of go-to therapies now for our advanced Parkinson's and essential tremor patients. So you can actually target the deep structures in the brain that contribute to these disease processes, and stimulate with high frequency sort of modulatory therapy that helps manage these more advanced patients that have had significant disease progression, and all the other oral medication therapies have started to become of limited benefit to them. So that's one of the main sort of therapies that we talked about. It is a surgical procedure that requires brain surgery, so it is invasive, and can be something that can take a toll on someone, especially if they have other pre-existing conditions. So that's something to take into consideration when you're considering a patient for deep brain stimulation. The other therapy that we talked about was MRI guided focused ultrasound. So this is not actually a device that someone takes home with them, but it's you use an MRI machine to deliver sort of ultrasound rays that can actually create sort of a lesion in those deep structures that create these disease processes. So it's indicated again for Parkinson's and essential tremor patients who have more advanced disease, and it doesn't require surgery. So that's one of the beauties of that, but it is a lesioning technique, so something that's a little more permanent, doesn't really allow for modulation the way deep brain stimulation does. But again, you'd want to take into consideration with your patient, like, what their other medical issues are and what their preferences are. And then we talked about some of the devices that are available that patients can keep with them that are not necessarily as invasive, although one of them, which is carbidopa-levodopa intestinal gel, is a little bit more invasive. It's a different kind of surgery where you have a tube that goes into your intestine that delivers continuous carbidopa-levodopa gel throughout your waking day. And again, that's indicated specifically for advanced Parkinson's patients who are having a lot of fluctuations in their symptoms throughout the day, and the oral medications have started to become less effective for them. And then the two other devices that we discussed were pumps, one for subcutaneous apomorphine, which is a dopamine agonist sort of therapy, and the other for carbidopa, phoslevodopa. And these two therapies are not FDA approved in the US yet, but there are phase 1, phase 2, phase 3 clinical trials. The subcutaneous apomorphine is actually in use in the UK and Europe for many years now. So we're hoping, that it will get FDA approved soon here. And then the carbidopa, phoslevodopa is relatively newer, but also shows promise in terms of helping our advanced Parkinson's patients with their motor fluctuations and other symptoms like dyskinesias, dystonia, stiffness, slowness, those kinds of things. So lots of good things in terms of the advanced therapies that we have available for our Parkinson's as well as essential tremor patients. I think that's one of the beauties of coming to a conference like ATMRD, is really getting exposed to what we can really offer our patients who have these unfortunate neurodegenerative conditions. But there are certain side effects and other patient considerations that you want to take into account when you're considering patients for these therapies.